One of the first questions I usually get is OT versus PT, and I say OT is the doing and PT is the moving. I feel like PTs get a lot of good press, and everybody kind of knows what a PT is, and the joke in OT is, well, no one knows what we do because we do everything. So I've helped farmers figure out how to vaccinate cattle. I have helped office workers figure out, how do I set up my workstation. I've helped construction workers figure out, how do I pull up in a cement truck. So I do a little bit of everything. And OT versus PT is one of my favorite conversations, because PT helps the body move, OT helps the human do. So PT is the moving and OT is the doing. And of course we overlap, because if you're doing something, well, you gotta move to do it. And usually if we're moving, it's for a purpose. I don't know many people that just sit there and just raise their arm up and down a whole bunch. So as PT and OT kind of enmesh and kind of overlap, it really becomes a doctor decision. So this is where we love our providers who understand the difference and who can listen to our patients and say, okay, it sounds like you're having trouble doing a lot of things. That is an occupational therapy referral. It sounds like you're having trouble living your life. It's putting a hitch in your giddy up. That's an occupational therapy referral. If it's, I'm fine, it's just the moving, then maybe more physical therapy would be appropriate. So step 1 would be pain, step 2 is range of motion, step 3 is strength. So first things first, you need to not be in pain. So how can we change the way that you do things? How can we change the way you put up groceries? Can you have somebody help reorganize your fridge so that you're not lifting a gallon of milk, you just get a half gallon, things like that. And then once that pain is under control, we'll do some stretches and exercises. Let's help everybody move as a team together. Let's help just kind of get that rhythm back going again. And once that rhythm is good, then we build up the strength of, okay, now you can start getting a full gallon of milk again. Now you can start lifting a case of water again. You can put up your Christmas decorations. But that's usually the last thing that I work with people on, because you need to not be in pain while you live, and then you have to be able to move. The first day, things might be uncomfortable because I have to see what hurts to do. After that, nothing should hurt. You can be uncomfortable, you can feel an effort, but we don't want it to hurt, because my first goal is to reduce pain, to get you back functioning again. Pain is such a barrier. So no, OT doesn't hurt.